Is eating a late dinner worse for your health? I'm Dr. Brett Scher, the medical director at dietdoctor.com, and we have a new study that suggests that may be the case. It's common folklore that if you eat late at night, it's going to go straight to fat and it's worse off. And so you want to eat earlier. Or maybe it's because in the Mediterranean countries, that's the way they eat. And it tends to be, sort of mirrored with a healthy lifestyle, that they have their biggest meal is like a late lunch and then a small snack for dinner. Well, it's nice to see more evidence sort of catching up with the folklore. And so I wrote a paper about a study that came out recently. There were 20 healthy volunteers. And what they did was they lived in an observational ward for 2 nights. The first day and night, everything was sort of normal. Then the second day, they were randomized to either having dinner at 6 p.m. and a small snack at 10 p.m. or a snack at 6 p.m. and dinner at 10 p.m. And then they measured blood sugar, they measured insulin, they measured cortisol, they measured how they slept. And then they measured their response to eating breakfast the next morning, with everybody eating breakfast at 8 a.m. Then 3 weeks later, they brought them back and they switched. So whichever protocol they were on before, they now did the other protocol. So everybody was randomized to sort of be their own control and compared to the other group. Now, what they found was pretty interesting. First, they wanted to see if sleep was affected, sleep quality, and they found it actually wasn't. So at least for a one-time eating dinner, a big meal late, didn't really make a difference. Oh, and I should also mention that the meal was 50% carbs, 35% fat, 15% protein. So again, not low carb, but again, that's not what they said they were setting out to measure, right? They were just wanted to measure the timing of the meal. They weren't so worried about the composition of the meal. So sleep pattern didn't matter, but blood sugar, oh my goodness, blood sugar definitely did matter. So the peak for the group having the later dinner was 150 milligrams per deciliter, whereas the peak for the group having the earlier dinner was 127. Same food, the exact same meal, just eating it 4 hours later made a 23 milligram per deciliter increase in the absolute rise of the blood sugar. But also, the group that ate dinner later, their blood sugar stayed elevated for 4 extra hours, 4 hours longer than the early dinner group. So, wow, for blood sugar, the same meal, the timing made a huge difference. But here's what's also interesting. The next morning, when they woke up, both groups had the same blood sugar. So by morning, it had normalized. And you can say, okay, well, the negative effect is over by morning. But no, after breakfast, the group that had the late dinner saw a higher rise in blood sugar compared to the group who ate the earlier dinner. So even though it looked like the effect was gone by the blood sugars normalizing, the effect was clearly still there, some element of insulin resistance. And the absolute insulin level, the absolute insulin exposure was not different between the groups, which is kind of interesting. So it was sort of the body was not able to mount the insulin response or wasn't able to respond appropriately to the insulin that was there. So after breakfast, the late group saw higher blood sugar rise. So you can imagine if that's repeated day after day after day after day, wow, that's a much greater exposure to elevated blood sugar simply by the timing of the meal. Now, it would be interesting to know if this was a low carb or keto meal where you're going to have a lower blood sugar swing anyway, would that make a difference? Interesting question. Don't know the answer to that based on this study. Cortisol was different as well. So cortisol, sort of the stress hormone, was higher in the group that had dinner late, and triglycerides. Triglycerides were higher in the group that had dinner late, and fatty acid oxidation was lower. So again, no change in what they ate, only a change in when they ate. Now, it would have also been interesting to see if they would have extended the time-restricted eating window by not eating breakfast or eating breakfast later, if that would have made a difference. But basically, for a randomized controlled trial, you can't answer all those questions, right? You have to focus on one question and answer that very well in a controlled fashion. And that's what they did. So the timing of the meal clearly made a difference. So if you're at all able to control the timing of your meal, try and move it forward. If you can make your lunch or a late lunch your biggest meal of the day and dinner a smaller meal, that seems like it might be the way to go. All right. And then we also have guides on time-restricted eating and intermittent fasting, so you can see how to incorporate those into your lifestyle. And we'll link to those below as well, because that can impact your blood sugar response as well. I hope this was helpful. Definitely please check out the links below. And if you do think this is helpful, click subscribe so you'll get updates to all of our YouTube videos, including our Diet Doctor Explorers series with Christy Sullivan and the podcast and so much more. I want to tell you something I'm really excited about. At dietdoctor.com, we have a specific page for finding low-carb physicians, and we just reached over 500 clinicians listed on this page. These are either physicians or healthcare providers who are knowledgeable and comfortable using low-carb nutrition to help people radically transform their health. And the more we have on this page, the more people we can reach, the more people can find a physician that they're looking for. I get inquiries all the time. Do you know somebody in my area? Do you know somebody who can help me in this area? And by having more people on this map, people can find them that much more easily. So if you're a healthcare practitioner who knows about low carb and is comfortable using low carb in the right situation, or if you're a patient who happens to know a physician who fits that, please share this page. Because again, the more people we reach, the more clinicians we reach, the more people we can help. So definitely check that out. You can find the link below for our Find a Clinician page.